Hello everyone, and welcome back to Restore Your Everyday. My name is Cosi Belloso, physical therapist amputee specialist, and I'm your host. This month, it's all about the skin you're in. We're going to be taking you through the different phases of recovery with regards to your wound care management and skin care. This first segment is going to be what you can expect immediately after surgery. Hi everyone. I'm going to talk to you a little bit now about what you can expect immediately after surgery. So the goal after any surgery, especially amputation, is to ensure an uncomplicated healing in as short a time as possible. The purpose of the actual surgery is to remove as much of the dead and damaged tissue as possible while making sure that good circulation is present to the remaining muscles and tissues. After surgery, you're going to have a dressing on your surgical incision. This dressing will either be a soft dressing, such as a gauze wrap, or a negative pressure dressing, also known as a wound vacuum or wound vac, or it might even be a semi-rigid or rigid dressing. Now, the dressing that your surgeon selects will be determined by the nature of your incisional wound. So for example, if your wound is still open after surgery for whatever reason, your surgeon may opt to use the wound vac to help with the closing of that wound. Or they might decide to apply a dressing that has silver properties to help keep that wound nice and clean as it heals. And if you have an uncomplicated wound, a simple gauze dressing over the sutures may be all that you need. So regardless of what dressing you have, it's really important that you have a conversation with your medical team before and after surgery about how you can maintain it and keep it nice and safe and clean while your wound is healing. Now, while the dressing will help you protect your wound during the healing process, the compression applied to your residual limb is what's really going to help you with that pain management. After any injury or surgery, the body's response is to produce inflammation or edema. All that fluid collects in the residual limb and it presses up against those tissues, causing that pain and tenderness after surgery. The best way to combat this inflammation or edema is with compression and specialized exercises. After surgery, your physical therapist will be teaching you certain gentle exercises that are going to help move that inflammation out of your limb. And by using your muscles, you're basically pumping the fluid out. Your surgical team is going to issue you a shrinker. This is a specialized elastic sleeve that goes over your residual limb. It's going to be a little tighter at the bottom and looser at the top to help encourage the flow of edema out of your limb. The more the swelling goes down, the more improvement you're going to notice in your pain level, and as a bonus, your wound is going to have even better circulation and healing. Now, protocols can vary from patient to patient. In many of my own patients, I recommend that they wear their shrinkers at all times of the day and night during those initial weeks after surgery and only remove it for showering or dressing changes. But this, of course, is something that's unique to every individual and needs to be cleared by your doctor. Now, swelling and edema can be present in that residual limb for up to a year or even more after amputation. Using the shrinker during your immediate post-op recovery and even later on is going to help keep the control of that volume in your residual limb. And we're going to get back to that in the next video. Once your wound is healed and you've been cleared by your surgeon to be fit for your first test socket, this is the point where I recommend that you begin scar tissue management and desensitization of your residual limb. So stay tuned for the next video where we're going to talk about just that.